Hello, everyone. Thank you for joining us here today. My name is Teri Halliwell from the Power of the Patient Project, and today we are joined by Mr. Michael Cahill. Michael is a licensed nursing home administrator and the administrator of Willow Crest Bamberger, a skilled nursing inpatient facility in Philadelphia that is part of Einstein Healthcare Network, a part of Jefferson Health. Michael has an MBA from St. Joseph's University and an undergraduate degree from the Arcadia University School of Global Business, both with concentrations in healthcare administration. He is recognized as an accomplished administrator, having worked in elder care for many years. So, hello, Michael. Good morning from the West Coast. Thank you for joining me here today. So, the complexities of caregiving can be quite shocking for those who haven't done much of it. We have parents getting older, children coming in later, and thus we have an entire generation taking on the duty to care not only for their parents, but also for their children. Of course, one option for them is to stay home if they can, but if they cannot, they have a lot of choices like retirement communities and nursing home facilities. How do we make the best choice for our family member?
I mean, from my experience, your best experience is financially, really. You need to know. It's tough to ask these questions to your parents, but you do need to know how your parents' finances look and what insurances and things like that that they do have, because if you're not prepared or you do not know these things, unfortunately, it becomes tougher on healthcare providers to take care of your loved ones. The other big thing to make the decision is how much care does your loved one actually need? As you go from retirement communities to assisted livings to skilled rehabs or nursing homes, um, those all are different levels of care that we all provide for your loved ones. So the best way for me to as a healthcare provider to help take care of your loved one is to do know your finances, because you get in situations today, especially how tough times are, that you want to take care of them, but you just can't because they don't meet the financial requirements. So,
Mhm. So you mentioned that financial is a very big aspect to take into consideration where we're making such decision. There is also another aspect where the elderly often deal with the nursing home idea with a negative connotation. Like, I don't want to go to a nursing home. It's not for me.
mhm.
I want to stay home. Even though the facts show that they really need to go to a nursing home. Um, how do we effectively communicate to our loved one that the nursing home is actually a very good idea for them?
Well, yeah, yeah, and I think right now you'll, especially regulatory wise, I don't think you're going to immediately get over that stigma that nursing homes are, um, how they're viewed, but uh, it really needs to be conveyed that from either a healthcare provider or you as a family member, that as you touched on, I can't take care of you by myself at home with the level of care that you need. And these skilled providers, although that they may get these bad raps or things like that, they get trained and they do know what they're doing to take care of them. Now, you as a family member need to do your research, I would say, and you need to ask the questions that and test some of these healthcare providers so that you do know what you're doing, or how to take care of them if you weren't there, how they're taking care of your loved one. So um, that's that's the best way, that if you're making that decision, is to just understand how these things work. And hopefully I'll be able to give you some of the general perspective of what the right questions and what the wrong questions are, because I think a lot of people especially as us as healthcare providers get family members that come in and just think that they know what they're talking about and they don't. And that makes it tougher for us to convey the right message to you if you try to just quote unquote think you know everything. And because we don't know everything. Healthcare is always changing. Nobody knows everything. It's a learning process, but if you collaborate with the healthcare provider and a family member, it makes our job easier because I don't know, I don't know your mom's daily routine. You knew it better than I do. So I need to be able to talk to you as a family member, and you need to be able to talk to me and ask these questions.
Mhm, mhm. You mentioned before that, we don't know everything. The healthcare is a community that is constantly learning. What are some of the challenges nowadays you think that we need to work more on nursing homes?
Well, I mean, as I think everybody saw from COVID,
Mm,
um,
yeah.
we as a country, I think right now in the healthcare system, not just nursing homes and all together, but we are very right now proactive I mean reactive instead of proactive in things. Um, right now after all of the COVID outbreak and things like that, I mean, everybody has staff shortages in nursing, nurses and nurses aides. Um, you know, we have here, you don't, not over on the West Coast, but here, I mean, we have some nursing homes closing because of lack of funding with Medicare and Medicaid. The Biden administration just hankered down more regulatory issues regulatory standards that are making it tougher for nursing homes to operate. And as we just saw with COVID, there are complex healthcare needs that our residents need that we weren't really prepared for. I mean, if you were involved in COVID, you could understand that nobody knew, nobody knew what they were doing. Nobody knew what the plan was and what healthcare interventions we could do. So that's something and it's not going to be solved in overnight. So we really need to take a step back and look at what can we do different. These healthcare providers, not myself personally, but nurses and doctors, and they're really doing tough work and long hours and things like that. And I think that's why it's tougher now because people before were very interested in helping others, and now it's because of the grueling standards they just don't want to do that. So there's other options that they can look at. So I mean, personally, that's some of the challenges that I
Mhm.
have to face now and coming in the future. I now work for a hospital system, so everything's a little bit different because we kind of run from the hospital down. So um,
Mhm.
everything's really changing. So
Mhm. Michael, you manage a large, skilled nursing facility. Can you please tell us what that is and what kind of patient it's a good candidate for this kind of facility?
yeah, so skilled nursing facilities are your traditional quote unquote nursing homes, but they have a little bit more skilled care needs. So that would be your physical therapy interventions, a little bit more of complex nursing interventions. So, for example, wound vacs, any type of wounds, um, dialysis, just tube feedings, trach care, things that uh, require a little bit more nursing needs or therapy needs. You get a lot of patients who are post-op of surgical interventions, so they lose a limb or if they got some type of surgery. Um, for example, the facility I run now, we get a lot of transplant patients. So people that had just recently gotten a transplant and they come here and do the rehab, and are monitored by our staff here. Um, though you do in a skilled nurse rehab do get nursing home patients, so I think that's kind of where the stigma that we discussed earlier is, a lot of these patients are here for rehab and want to go home as quick as possible, though they're in a setting where there are people there that are there for the long-term living. So you get commingling and things like that. So uh, that's where I think a lot of family members that say, well, I don't want them to go to a nursing home, and it's not always just a nursing home. We offer other services. So
Mhm. Other services like assisted living facilities, for example.
yeah, assisted living facilities are though they do have some rehab, they are for people who are a little bit more less codependent on others for care. So you'll see a lot more independent people that are at assisted livings, people who can take themselves down to like the dining room, who are able to ambulate or walk independently, um, who can take themselves to the bathroom if they need. Um, there's less nursing supervision in assisted living facilities than there are in nursing homes. So um, that's why it's usually tougher for nursing homes compared to assisted livings because you need more staff to take care of more complex people. So it it's a little bit nicer you'll see in assisted living facilities because no, number one, you're paying less people that are more skilled, not skilled, but more trained in their job. And they take private funds. So there's no insurance or Medicare, Medicaid in assisted living facilities. That is all nursing homes and skilled rehabs.
Mhm. Um, through your point of view, why do you think nowadays there are more assisted living facilities being built than nursing homes?
Well, I mean, number one, it's like I just touched upon, they're private funded, so they don't wait as long for finances as, rehabs and nursing homes. Um, they're also less regulated. Uh, so because we take government money, Medicare and Medicaid, we're also governed by the government. So we are surveyed by the government to make sure that, we're using the funds appropriately and things like that. Um, I think personally that people have this view that everyone qualifies for an assisted living and that they have much more confidence in assisted livings because they aren't as complex of care. So if I don't have to have the person live with me, I could still trust that they'll be safer in a general spec because they're not as much of care. I mean, there's so many varieties because you have people that would be home but they go to adult daycares and things like that. Me personally, I feel as though that's kind of like the same kind of view, except they live at this facility. So, also personally, both of my parents run assisted living facilities. So, I've pretty much grown up in assisted living facilities my whole life. So you get much more of a community-based view of assisted livings and retirement homes because they are more together. They have more independence and more availability of things to do outside the facility and things like that. While while you're at these skilled nursing and rehabs, you're more focused on your care and getting better.
Mm-hmm. So it's like a college dorm for the elderly, I guess.
Yeah, a little bit, but like we touched upon earlier, this is the biggest thing that you as a loved one need to prepare for because just like that, your family member can take a turn and they're they're not appropriate for assisted livings anymore.
Mhm.
You hear my parents tell me all the time that you feel bad because you've been with this person for 2 to 3 years and they're just getting sick and they can't the facility can't take care of them anymore. They don't have the staff to be able to do that. So they have to go to a rehab or a nursing home.
So Michael, say that for some reason something happens to me and I leave this world, and then my parent is the only one left in the facility. What kind of measures does the facility or the government or even the insurance take in order to facilitate the continuing well-being of my parent?
It's different on every circumstance. You know, again, for example, I would just in your circumstance, it depends on loved one's mental capacity and things like that. We as healthcare providers are making sure that we're doing everything that's in the best interest of your loved one. There's obviously, HIPAA and fraud and financial abuse that is exposed by some people in this country to loved ones and elderly people, but um, there's a lot of avenues you have to go over once you lose a loved one or um, you're trying for guardianship and things like that. So the best advice is to make sure that you you guys have contingencies for if you or your loved one passes away, power of attorney, wills, things like that, because
Mm.
you just never know what can happen. And I think that's why like I said earlier, we are as a country have a big problem in healthcare with being proactive. We're very reactive. And when you're not prepared, it's tough to get all of this stuff done right away.
Mhm. So we're more reactive than proactive. I think I can agree with that. Um, Technology is constantly advancing. How we can incorporate technology for the benefit and improvement of the nursing homes, retirement communities, so on and so forth.
I mean, I think I even since I've gone to college and I first started, I think we've taken big steps technologically with continuum of care. When I first started out in a nursing home, everything was paper. Everything was paper. So if you're looking for somebody's, results on a lab, it was on paper. Um, you know, that's changed. It's a less paper world now. And the good thing that we have now is that since we're collaborating so much with hospitals and outpatient and just other healthcare specialists, they do more of like a healthcare exchange where you can just get the results tab even if you're not at that doctor or whatever. So it makes getting information a lot easier to complete more of intervention and healthcare needs for your patients. The biggest thing that you have is a delay. Like somebody gets labs done and you don't have the labs, or you have to wait till they fax it over, or things like that. Where if you could just pull it up right away, call the doctor, boom, they're already getting a med or something that they would need that would be better, more beneficial. The biggest thing that I've seen it for healthcare and technology is that we all the information is much more available.
Information, testing, medical machines, maybe robot nurses in the future?
No, I don't think that'll happen.
You don't think that will happen? Okay.
No, no.
All right. Michael, how do you see, what's your projection for the next 5 to 10 years, when it comes to older facilities?
I mean, I I've touched on it earlier. I mean, we just have to prepare for what's to come. I think there's so many questions right now that we are not prepared for, that we just need to know what's the future. Are we going to invest more in nursing and education for nurses? I know we do it for doctors, but are we doing more? Are we going to do more for the frontline workers? What's the financial pyramid going to look like with Medicare and Medicaid? Because and insurances, I mean, I know we tried it with Obamacare and trying to get young people to pay more early on to help our older population. Um, but the insurance companies still kind of rule the world around here. So I
Mhm.
think with COVID, they kind of let up and it made things a lot easier for us to take care of patients. But we're kind of going back to that uh,
Mm.
before COVID time, and people don't understand why they aren't authorized to get this service or why they have to go to this provider. And it's tough. There's a lot of questions that are still unanswered. And unfortunately, um, in this country, healthcare is so politicized, and you just from one year to the next, anything can change. I mean, we're still discussing whether it's a right or not, and um, if this person can get this surgery or not. So um, I think, unfortunately, until we as a whole country agree on something,
Mhm.
this is kind of like the norm is,
Mhm.
it's expensive. You need to prepare yourself in the future. You need to know your family's financial structure and what they can and can't afford. Because if you aren't prepared, I see it all the time as somebody comes into our nursing home and they're asked to get, their family members' bank statements, and they don't even know what bank they use. I mean, that's tough for us to take care of your patient or to get you financially not liable. Because if your loved one is in any sort of situation, they don't look at the loved one, they look at you and what you've done to help them, and how are you going to help them, take care of these financial liabilities that they owe.
Michael, do you feel like part of the problem is that they may also deal with disregard for the elderly people, like their life doesn't matter anymore as much because they are old already?
Um, I, 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 I think it's a strain. I think there's not a view that they're old. I mean, I've grown up in a view of, they've accomplished a lot. They've done everything to take care of people before them. We should take care of them. Um, that's how I view. Now, that may not be the view of everybody else. I mean, you do get you get stigmas in certain type of situations with people's diagnoses. For example, you have somebody who has some sort of stage 4 cancer. They're older. They're, some families want them to do everything they can to save their loved one. Put a trach in, put a feeding tube in. That's a lot on your loved one to have to deal with all of that, and it's expensive. It's a lot for nurses to take care of people with trachs and tube feeds and wounds and things like that. So you do get that sort of stigma. Like, it's costing more on your loved one than it is for them to just quote unquote go on hospice, or then they would get more comfort care. But it's all your view. I mean, everything's in your own perspective. Some people don't want to do that. They don't want their loved one to go through all of that. Some people want to do everything they can to save their loved one, and it it's tough. It's tough either way. I can't say that there's a right answer because, you know, I haven't had to do that yet, but I can see how each side views it, and it is a lot, and it's a lot for
Mm-hmm.
us as a country too, because there is no set answer.
Mm-hmm. Sounds like uh, an answer that you are trying to make based more on emotion than reason.
Yeah.
All right, thank you, Michael, and everyone for joining us here today. I am Teri Halliwell for the Power of the Patient Project, the National Library of Patient Rights and Advocacy. We'll see you next time.